Hello there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Karpan. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. As usual, we start off with me wearing my mask, covering both nose and mouth as the correct way. It is not suitable to wear the mask under the chin. It is not suitable to wear it on the head. I'll take it off as we continue the rest of our conversations because there's no one here within 6 feet of me, so I'm not putting them at risk, and neither am I putting myself at risk. Remember, if you have any questions or comments relating to the COVID-19 pandemic, please feel free to send a WhatsApp message to 620-6275, or you can send an email to docandcovid@gmail.com. So today, we're now in the middle of April 2021, and we started vaccinating people 18 years and above. That's 18 years and above residing in Guyana. This is a remarkable achievement. And yesterday, I put this information up on my Facebook page. And immediately, people were pleased, but there's lots of questions and lots of areas that people needed clarification on. And before I talk about some of the concerns that people have, I want to address two questions that kept recurring. The first one relates to the use of vaccine in women who are pregnant. And the Center for Disease Control in the US, as well as the World Health Organization, has clearly stated that there is no reason for pregnant women to be denied the vaccine. Let me make that clear. Pregnant women should not be denied the vaccine. There are no reasons for pregnant women specifically to be denied the vaccine. If a pregnant woman happens to have severe allergic reaction to vaccines, maybe that's a reason for them to consult with their medical provider before making a decision. But just being pregnant alone does not prevent women from getting the vaccine. The second recurring issue or question that was posed is, what if women are breastfeeding? Should they take the vaccine? Again, the authorities that we look for guidance, these people have said quite clearly, the WHO and the CDC, that there is absolutely no reason for us to deny vaccines to breastfeeding mothers, except if they have the usual reason for denying vaccines. That is, severe allergic reaction to the vaccine or vaccines previously or any component to this vaccine. So breastfeeding by itself is not a reason to withhold vaccine from breastfeeding women. These persons can take the vaccine. So I hope that would clarify the question as it relates to these significant group of people, pregnant women as well as breastfeeding women. So recently there's been a lot of attention in the media especially about blood clots and the link with vaccines. Not only the AstraZeneca vaccine, but also the Johnson & Johnson single-dose vaccine, which was just rolled out in the US. The Johnson & Johnson vaccine has also, unfortunately, been halted because of some rare blood clots in unusual places. So I wanted to spend some time today again to talk about blood clots. Ordinarily, how can people tell if they have blood clots? Well, the symptoms of blood clots can include throbbing or cramping pain, especially in the legs. The area where there's a blood clot may have swelling. Especially in persons of lighter complexion, you may notice redness, and in others, the area may have increased temperature or warmth. And if it's in the arm or the leg, that's where you expect to find the increase in temperature. Now, if these clots move from the arm or the legs and they go to the lungs, they can cause sudden breathlessness when the clots end up in the lung. That can also be associated with sharp chest pain, and sometimes that type of chest pain can get worse when you take a deep breath in. Clots in the lungs usually occur suddenly, and it can also be associated with coughing, and sometimes that coughing can cause people to cough up blood. You can see streaks of blood or spots of blood in the sputum. And that's important to know because there are ways and emergency measures that these patients can be treated with. As it relates to clots and vaccines, the specific things to look for, the specific symptoms that one should be aware of, is if there's a severe sudden headache. And why is that? Well, there seems to be a rare link between the administration of vaccines, the AstraZeneca and the Johnson & Johnson vaccine, with a very rare type of blood clot that occurs in the brain. And the chance for that happening is less than 0.00004%. 0.00004%. It's less than that. So it is possible, but it's extremely, extremely rare. So sudden severe headaches, and it usually occurs 7 to 10 days after taking the first dose of the vaccine. The other rare blood clot location is in the abdomen, somewhere near the liver. And so we also look out for severe abdominal pain. If the blood clots occur in the legs, you can have leg pain, and if they move away and go to the lungs, of course, you can have severe shortness of breath. So I mentioned to you before that the second vaccine, the Johnson & Johnson vaccine, has now been recalled, or put a pause has been placed on its use in the US market. So they started giving it out, and several millions of people would have had this vaccine, and they noticed 6 rare cases of blood clots in the brain, and they halted the use until further evaluation. So out of 6.8 million doses of Johnson & Johnson vaccines that were given in the US, there were 6 reported cases of a rare but severe type of blood clots. That's like 1 in a million. And the adverse reaction, of course, appears to be very, very rare. And of course, when these things happen, they require further investigations, and that is what they are doing at the moment. So to summarize what really happened there, you have 6.8, almost 7 million doses of the vaccines, of the Johnson & Johnson vaccine that was given, and this is a single-dose vaccine. There were 6 reported cases of blood clots, and these occurred in women between the ages of 18 to 48. So that's the younger age group, and it occurred just between the first and second week, day 6 to day 13, after the vaccine was administered. Now remember, the Johnson & Johnson vaccine is a single-dose vaccine, and that has its own attraction for people. You know, instead of getting 2 sticks or 2 bores with a needle, people prefer to get a single stick. I know by my own personal experience, I would rather get stuck once than twice. But, you know, if this becomes a safety issue, then we need to weigh the benefits over the risks as well and make an informed decision. So there were 6 cases of these rare blood clots that occurred out of almost 7 million people. So, and that caused the vaccine to be halted. Again, I remind you that this Johnson & Johnson vaccine is a single-dose vaccine. It is stored in a normal refrigeration temperature and conditions. The plan was for Johnson & Johnson to deliver 100 million doses of this vaccine by June 2021. Obviously, now that there is a pause in the use of this vaccine until further investigation, that number will definitely be affected. Now, it is important to note that this vaccine went through the trials not just in the US, but in South Africa. And if we recall, the last couple of months, we would have recognized a couple variants in the COVID-19 virus. We have the British variant, we have the Brazilian variant closer to home, and we had the South African variant. The Johnson & Johnson vaccine, initial reports suggested that it had between 70 to 90% efficacy or effectiveness in preventing severe COVID infection. And one of the reasons they thought that it was closer to 70% was because of the South African variant that was developing. Remember, when the vaccine was first being developed, they were just dealing with the original COVID virus. By the time vaccine got to phase 3 trials where we were using it in humans, etc., the virus would have changed and mutated and produced the South African variant, the Brazilian variant, and the UK variant. So it is thought that perhaps it was not as effective against the South African variant, and that is why the efficacy in some of those areas was closer to 70% rather than 90% that some of the other available vaccines had claimed. So again, looking at the Johnson & Johnson, the overall effectiveness, which is the prevention of moderate to severe disease, was about 66%, or 2/3 of persons who got the vaccine. In terms of severe illness, it was 85% effective in preventing severe disease. And the one that is most important, it was 100% effective in reducing hospitalization and death. And it was 57% effective in the South African variant. So the third point there of the Johnson & Johnson vaccine being 100% effective in preventing hospitalization and death, that is true for all of the vaccines. The AstraZeneca vaccine, the Sputnik vaccine, the Sinopharm vaccine, the Pfizer and the Moderna vaccines. All of them have been shown to be 100% effective in preventing death and hospitalization. Remember, there are so many persons who can be infected across the world, but not everyone will be eligible to be admitted to hospital. Not everyone becomes sick enough to be admitted to hospital. We only admit people to hospital when they become so sick that their oxygen saturation starts to fall below 95%, their blood pressure starts to get too low, they become confused, delirious, etc. These are all things that we use to determine who should be managed in hospital or who should be in home isolation and can be managed in a less severe setting. In Guyana, we also have the Sputnik vaccine, and this has been touted as a vaccine for all humankind. The safety and effectiveness of this vaccine has been validated by peer review across the world, and specifically it was published in the Lancet Medical Journal, which is one of the most highly respected journals after intense scientific scrutiny. The efficacy has been confirmed at 91.6%, and again, it is 100% effective against severe COVID cases. So I hope this would have helped us to understand a little bit more about blood clots and the vaccines that we have available. And I want to encourage you all to make sure that you get your vaccines, and the only people who should be cautious about taking vaccines are those who have severe allergic reactions, otherwise known as anaphylaxis. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.